Good morning, everybody. My name is Christine DeZoga. I'm the program director for medical assisting. I brought along two students as well. So Pamela and Jocelyn are online as well. So if you have questions that you want to actually ask the students from their experience, that always is very telling. I will start with how you get into our program. The first thing that you will have to do is apply to Malcolm X College. Obviously, you go through that process. We are a specialized selective enrollment program, and so you do have to be at college level English and college level math. That can be done by either having taken those classes, or there are placement exams that can place you into that eligibility. Once you have completed that step, the application will open to you. And you're going to fill out the application that you're interested in the program. We will then reach out to you. There is an essay that has to be written. It's more of a reflective essay. So it's more from the heart than it is that we want you to Google anything. We actually provide you different scenarios that we want you, and we give you prompt questions to answer. For instance, the last one we sent out had to do with how would you handle working with people who are much older than you are, given how sometimes someone in my age group might say, you use your computer too much, and things like that. And how would you work with that kind of person? And so we give you a couple prompt questions about that. And the actual selective admissions portion of it, interview portion of it, is not to deselect anyone, to be quite honest. It is more to see if you're actually interested in the program. Did you choose the right program? Because I do get a lot of people, once we start talking about it, they're like, oh, I didn't know that was medical assisting. And we realize that after we talk, like, oh, you're really interested in radiology. Here's that program director's name. Or a lot of people look at the fact that, oh, it's a certificate program. And sometimes you might hear that that's the easy route. It's not easy, it's accelerated. So there's not I wouldn't say that for full transparency, the only reason that our program is a certificate program is because as a director, I had to look at what the workforce was looking for, and they were looking for the certification. So if we can get you out there sooner, certified to be able to get the job, without the need, if the workforce doesn't tell me, they don't care, they don't see a difference in an associate degree and an advanced certificate in the medical assisting arena. They don't see the difference, and they're not going to give you any pay difference. So it didn't seem plausible to keep you here for 2 years if there wasn't any incentive to do so. And so we have two different options. When we start in the fall, we're full-time. That is a very heavy load. I generally tell people, if you don't have any children and you can devote time to school and maybe you work part-time, you can possibly handle it. Not that doesn't mean if you have a full-time job, you can't handle it, because, people are amazing and do amazing things, but it's just kind of to give you a heads up, because you'll be taking between 4 and 5 classes for 2 semesters. And your third semester, you will be out on clinical rotation. The part-time option, we start that every January. That will take you into lessening the class load. It gives a slower pace to the program so that you will be down to 2 classes, possibly 3 in one of our semesters. Sorry. And if you are full-time, you will finish in 3 semesters, which is just under a year. If you are part-time, you will finish in about a year and a half. It takes about a year and a half, so we just stretch it out longer. It's 4 semesters. We offer day and evening class sessions. So when you're interviewed, we ask you what works better for you. If you're a morning person, I'm not going to stick you in a night class. And we want you to be truthful. Don't answer. The reason we ask that question is we want to make sure that we're placing you in what works for you in your life. So you have the option between morning and evening. Now, the things that you will learn in medical assisting, we are the jack of all trades, master of none. So what that means, or I should say master of none, but you are going to be learning phlebotomy. You'll be drawing blood, you'll be giving injections, you're going to be doing EKGs, You'll do all of these strep throat, we're going to take you through all the point of care testing, which is everything, any kind of testing that you get done in a doctor's office, strep testing, COVID vaccines, COVID testing, all of that is being taught here. We do practice on each other. Even in the midst of COVID, we have created a way that you will have to practice each other in the labs with safety protocols in place. That's because as much as we simulate, we do use simulations in the labs, we want you to get that real life feel for what it feels like, one from the patient side, so that you can be more empathetic toward the patient. Somebody who's scared of needles, you have to be able to react to them. So I'm going to call on, I see Pam. So Pam, did you want to kind of talk about the program a little bit from a student perspective?
Hi, everyone. I hope everyone is doing well. Thank you, Christine, for inviting me here today. Hi, Afra. How are you today? The program I started as a full-time student. I started in the fall of August 2019. I didn't finish until late 2020 because of the pandemic, but I took the night courses, and it was, I thought it was challenging, nothing too hard where are just like, oh, I can't finish this. My teachers were very supportive of me. Whenever I felt doubt in myself, I went to my professors and they helped me along. They supported me. They told me I can do this, I can finish this, don't doubt myself. And so I just, continued through the program. It was a little longer than a year again, like I said, because of the pandemic, our classes were suspended for a period of time. But when we came back into the classroom following COVID-19 guidelines, we continued our education and picked right back up where we left off. I would like to say that the labs were excellent, because like Christine says, you do practice on each other. You need that one-on-one time with a real person. Is very different when you're working with, for lack of a better word, a dummy, or like say a dummy hand, or a mannequin, as they would say, is a very different feel than when you're working with each other, and you get to know each other pretty well because you are in the program together. You see each other. I believe it was like maybe 4 to 5 days a week. So you get used to each other, and you're studying. May have a study group together. You're talking with each other like, hey, I didn't do so well on this test. Can you help me study? What did you do? You did well. You're picking up study techniques from each other, and you're watching each other in the labs to see how student A does it. Everyone does it differently. As long as you're following the technique that the professor has put forth to you, it's okay to do it differently than student A or student C. Student Z, don't worry about that. Worry about how you are comfortable doing it, as long as, like I said, you're following the professor's techniques and following through, listening to their guidelines. They give you excellent feedback as soon as you maybe do an injection, or if you're in the phlebotomy portion, they give you excellent feedback and let you know, "Hey, you didn't do this. Hey, remember to do this." And so each time that you're in the lab and working with someone, you get better and better. And that plays along and goes great with when you are doing your externship. At the end of each program, there's an externship that you do at a hospital or a clinic that they choose for you. You do have input in that, but I thought it was excellent because I put those skills that I learned in the classroom, I put them to use with a real life patient. And I was extremely nervous day one. At the end of my externship, I was like, I have this. I can do this. So I learned a lot from my externship, and you're working every day. I was able to do 40 hours a week, 8 hours a day. And so I went to work, just like uh, a medical assistant would just get up and go to work every day. And so I saw lots of patients. I gave a lot of injections. The A1C test, I was able to administer there. You learn a lot, and the MA that you work with, they are there with you right along the way. Don't be afraid to, step in and say, "Oh, I saw you do this yesterday. Can I do it today?" Be a voice. Or, "I don't feel so comfortable doing this. Can I wait to see you do it again?" don't be afraid to put your input in because you're there to learn. That learning is for you. And you want to be able to take those skills. And most of the times the externship sites do offer you a job. So you may be working at the end of your externship. And that is the goal of the program to get you working in the workforce. And you can always go into specialties like you can get an ECG certificate, things like that. Um, so I thought the program was great. I didn't think it went too fast or too slow. I thought it was an excellent program, and it's great as if you're high school students to get out there right away, and you make excellent money, and that's always good to have.
I do enjoy the medical assistant program. I joined it because after graduating from Malcolm X with my degree already, a lot of hospitals didn't want to accept me for the experience. So my doctor told me to join the medical assistant program. So when I got accepted, I was excited. So like the hands-on experience, I love it on Thursdays because it's hybrid class. Like we are able to go to throughout the whole class and like practice on each other with vital signs and learning like the different skills we have to learn. And then on Wednesdays, we have our online class with Mr. Rocco, and it's really interesting. Like he gives us the details about what's going inside the clinics and understanding what we have to learn. And then we almost done with this session. At the end, that's when we have our finals to pass to go on to the next course. And I really just like it because it's like I've always wanted to be in the medical field, so it gives me the chance to like get the experience I need and to understand what I'm learning and having fun and like growing a bond with the other students, with other classmates, and just having fun and like just learning what you need to learn. And Miss Christina is very helpful in our instructors. Like if we need anything, we can always go to our instructors first, and we still don't understand, we go to Miss Christina, and she could explain it to us like better.
When you're talking about the clinical externship, everything in our program, we invite you in as, I call it, we're all a team. So we don't like to have this, I'm going to call it professor on a pedestal type of environment. That's not our environment. Our culture here is you're part of our team. We're here for you. And we are extremely interested in helping you complete the program, whatever it is, if it's life issues or just whatever comes across.
I need to go to this. I don't know shit.
So what we do is we're just constantly in communication with the students, wanting to know what's going on with you. And like I said, you may not feel comfortable coming to me, go to one of your professors. We work as a team together constantly to offer supports. And we've learned a lot going through COVID because that was a different world for us. But the other thing is your externship, when Pam had mentioned you're part of it and we place you, we look at a lot of different angles on this. One, I am familiar with all of the clinical managers we work with, and we work with over 200. And we have a lot of clinical sites. The medical assistants are extremely sought after. So if you're interested in getting a job, you should not have, there shouldn't be a problem. And we'll assist, we have our departments that assist you in that as well. But what we look at when you're going to clinical externship is we ask for, how you're going to get to your site. We're going to ask you, what are your interests? Do you like children? Do you want to avoid children? Because if you don't, we want to avoid children, we're not going to send you to Lurie Children's Hospital, because that would be a very long 160 hours. We ask you, what is your availability? And the reason that we ask that, we want you to be 100% honest about it, is because that helps us to determine where we can send you. So like Pam had said, she had open availability. So we were able to send her to a site that said, oh, we want them here 40 hours a week. That's not, some people, you have a job and that's not going to be the option. And that's okay, because we have sites that'll say, okay, you give us your schedule, we'll negotiate with the site, and then you will stick to that schedule. So if you tell us I've got Monday and Tuesdays, we will work with a site that we know will give you Monday and Tuesdays. The other thing is, you all are going to learn the same skills and you all come out with the same skill set, but we're dealing with people. So everybody has different personalities. And I always give this example when I'm talking to the students, and it's funny that I even ended up in teaching it as now, because when I was a clinical manager, I was very fast paced. I worked in an extremely busy clinic. And if you sent me a student that would follow me, if I said, go room that patient and I walked away and you followed me around, I was going to call the school and say, take this student back. Not because I was bad or the student was bad. It's an oil and water kind of personality thing. And so we take it a step further and we look at personalities. So you might be somebody who wants to be in a very nurturing environment, or you may have, like Pam, we identified in her, she had this, like, she could catch on fast and she had this personality, you know, from whatever experiences she had in the past. It doesn't have to be healthcare, that we could throw her into something faster paced and they would, she would be able to be fine there. But if you don't, you know, if fast pace is too much for you, we're not going to throw you in there. Not to say that you'll never get there. It's just, you know, just steps to get to where you need to be. And that's how we choose your site and how we take your input in as well. So it's not that we just put you somewhere. We want your input and then we kind of use all the information, if that makes any sense.
Yes, thank you so much, Christine.
Yeah.
We have a lot of questions racking
Yep, I'm
up.
seeing them
If
pop
it's
up.
okay,
Yeah.
I will go through them. How long does the program typically take?
So if you're full-time, it'll be just under a year. If you go part-time, it will take about 1.5 years.
Okay. And is there a GPA requirement?
So not to enter the program, you do get points for whatever your GPA lands on. You do have to maintain a 2.0 to get your credential though. So we do look for you to be at least around a 2.0 when you're entering the program, because it would be difficult to bring it up to a 2.0 during the program.